And it's such a pleasure to be here today. As we all know, caregiving can have financial, physical, and mental tolls. And without sufficient supports, its effects can impact the level of assistance and aid that caregivers can provide to their loved ones, who are often Medicare beneficiaries. We funded a survey that was conducted by Cascada Consulting, and not too surprisingly, it found that about half of caregivers said that caregiving had taken a financial toll, about half said it had taken a real physical toll on their health, and about half said it had taken a toll on their mental health as well. And all this is really to say that this is not an important small problem. This is a big and important issue. So the Biden administration has made modifications to the Medicare physician fee schedule that are designed to help beneficiaries, healthcare providers recognize and support the caregivers for Medicare beneficiaries. And as a health insurance program for older adults and people with disabilities, Medicare can be an important conduit between caregivers and their healthcare providers. So it is my pleasure to introduce this discussion around Medicare's role for caregivers that includes Dr. Meena Seshamani, who is the Deputy Administrator and Director for the Centers for Medicare and Medicaid Services, and she will have this discussion with Jason Resendez. So thank you very much.
Great, thank you so much, Gretchen, for grounding the conversation and for all the work that you do to bring visibility to Medicare's potential to better support and recognize family caregivers. And that potential wouldn't be possible without the personal leadership of folks, of public servants like Dr. Seshamani. Dr. Seshamani, we've had the opportunity over the last couple years to work together, and one of the things that I truly admire about you is that you bring to these discussions around policy and CPT codes and reimbursement pathways, lived experience, personal experience, and you don't shy away from bringing that to the table. So would you mind sharing with the group your personal caregiving story and how that shaped your critical role at Medicare?
Absolutely. Is this on? No. Oh, it is on? Okay. Absolutely, and it is so good to be here with all of you. You know, I think for many of us, we are caregivers, and we don't necessarily know we are. Or we know we are, but we feel that we can't share that we are for concern about judgment, or well, then can you do, you know, X, Y, Z in your job, since we know that most caregivers are employed. And, you know, I think all of that really came to a head for me in this job, leading the Medicare program, where I actually had a friend and colleague tell me, you know, we talk about double caregivers. I think you're like the triple caregiver because you're taking care of, you know, your kids, you're taking care of your parents, and you're also taking care of 66 million Americans. And I hadn't really honestly thought about that. And so I think it's been very important to me to be able to share my own experiences to normalize this, because that's the only way that we're going to be able to drive change to really support the people who are making care run in our country. So you asked for an example. So I was in Detroit a few months ago, and I was speaking, it turned out, to the Rosalind Carter Institute. And before my session, I got the phone call, you know, where you see the number and you're like, oh crap. And I had a family emergency, so I said, I'm gonna be a little bit late, I'm really sorry, and you know, tried to handle it, and then went into the room and I said, well, if anyone will understand, it's all of you, that I'm right now having a family emergency, so I may have to take another call while we are talking, because I'm trying to like figure things out, like from Michigan on the East Coast. And so sure enough, like I had to take another phone call, like I got a call in the middle of that session, but we did our session, we talked about all the ways that we have to work together moving forward, and I actually got a really nice note afterward about like how important it is that we are bringing our lived experiences to the work that we're doing. And you know, I think that we absolutely can and should talk about the CPT codes and the reimbursement, but I also know all too well that you can put something in a payment regulation and it can just be in a payment regulation. Like, it really is about mobilizing the community so that you can make sure that where we have been trying to provide the resources, that it actually is utilized to improve the lives of people in our communities. And I think that's why having these kinds of conversations is so important.
Absolutely. No, thank you so much. I think, you know, the saying goes, life happens when you're busy making other plans. I think the same thing goes with care. Care happens when you're busy making other plans. And while we can't always plan for care, we can anticipate the needs of caregivers, and data better helps us to do that. And we know from our research, Caregiving in the US, which we conduct in partnership with our friends at AARP, that nearly 60% of family caregivers are navigating complex medical and nursing tasks as they provide care. Yet there is very little conversation with healthcare providers and health systems to support that level of complexity in care. That's why we're so excited about some of the big changes that are happening through the Medicare program to better recognize, engage, and support and train family caregivers. And the big development being the introduction of caregiver training services and reimbursement. Can you tell us a little bit about this new frontier of reimbursement that centers the engagement and training of family caregivers?
Absolutely. So, whoa, that is much louder. So we have created a new payment code for clinicians to be able to train unpaid caregivers. We started with training in ADLs and IADLs and behavioral management. And then again, thanks to many of you for providing feedback, expanded it this year. In particular, one thing that I'm very proud of is expanding it to include direct care services. You know, when I was a surgical resident, I remember doing rounds in the hospital at, 5:30 in the morning, and you're waking people up and the family is not there yet, but they're ready to go home from the hospital, but they have this wound that needs to be dressed, and it's kind of like you're just crossing your fingers and hoping that everything will be okay, when the person goes home, and there's got to be a better way. And so being able to provide the resources for that kind of training, it just makes sense to be able to enable people to stay at home, be healthy, be cared for. And I think all of this also dovetails with the downstream impacts that caregiving has on the health of the caregivers, because remember that a lot of caregivers are themselves on Medicare. So just in so many ways it makes sense, and where we are also looking to make sure that everybody knows about this, so that people who are caregivers can ask for training when they need, but then also making sure that clinicians know how they can provide this kind of training and providing that kind of support so that the training occurs.
Yeah, and I'd love to explore that a little bit more. We just released last week research looking at 114 major transplant centers across the country, and we asked them about their support and gaps for family caregivers. As many of you know, within transplant, there's a real key necessity to identify a caregiver in order to qualify for transplantation. And what we found were tremendous gaps. What we found was a hopeful thing within that data was that 80% of the centers had heard of these new reimbursement pathways, but just 7% reported that they were actively working to implement them. So what are opportunities that Medicare and advocates can embrace to ensure that systems, health systems and providers are ensuring that they're not just payment codes within a 3,000-page PDF, but actually being put into practice?
Yes, thank you for reminding me that the physician fee schedule was 3,000 pages this year, No, I think you're exactly right. I think that's where there needs to be that groundswell of, hey, this is really important. So, not only update your billing and accounting so that you can utilize these codes, but also here are partners for being able to provide the training. Highlighting, for example, again, thanks to feedback from many of you, now these services can be provided by telehealth, making that clear. I think those are the ways to really encourage the uptake on the ground of these changes. And I would also say moving forward, there are many other things that we have done to support caregivers, which, I'm sure we will get into. Specifically with the physician fee schedule, we also are we're looking to create more, bundled payments for primary care to try to get at the burden that doing like a nickel and diming of each, code, that barrier that burden can create. And so we created these advanced primary care management codes in the recent 3,000-page physician fee schedule, and specifically asked for comment on where that can go next. Because we started with chronic care management, transitional care management, but is this something that perhaps caregiver training could get incorporated into? Or we also created codes for care navigation and community health that I can speak more about. There are further opportunities where, number one of the barriers to take up is, the fact that people don't know about it, which is where just that awareness and that engagement is important. Number two, where people don't know how to actually do it, so creating those partnerships is important. But number three, the burden that is created when you have to do all of these individual, billing codes, and that's where, we have started a journey on creating more of these, hybrid bundled payments.
Thank you. I think you did a beautiful job of underscoring, and I appreciate your efforts to underscore the importance of the voices of the folks in this room in shaping that policy. We have been excited about the opportunity to mobilize stakeholders across the care continuum, patient advocacy, disability, and aging, to ensure that they have a voice in the development of the physician fee schedule, so that these policies that are developed, as we heard this morning, are developed with the caregiver in mind. And that's absolutely critical. So I think that's a great point to make as we think about how do we continue to iterate on this progress and drive towards implementation. Another area that we're also excited about that is, I think, a new frontier in how we integrate caregivers into complex care is the guiding and improved dementia experience model. I think we'll be capturing so much amazing, rich data over the next 8 years around the guide model in a way that we're able to better argue something that all of us know, that when you invest in the caregiver, you're improving caregiver outcomes and patient outcomes, particularly when it comes to complex care conditions like Alzheimer's and related dementias. Can you tell us a little bit more about the guide model and how you think that guide can maybe lay a foundation for other complex care areas?
Absolutely. So, the Center for Medicare, we have partnered very closely with the Innovation Center over the past 3+ years. Before I took this role, I was taking care of patients. In fact, up until the Friday before I came to Medicare. And I was leading all of the care transformation efforts for a major health system. And the pilot graveyard of you have some great idea and it works, and then it doesn't have anywhere to go, was definitely something that I wanted to address in coming into the Medicare program. So we have partnered very closely with the Innovation Center, where they are our research and development arm. So hopefully you all have seen, in fact, many of the things that I have just talked about, the bundled primary care code, the community health payments, those are all coming from successful Innovation Center tests that we are scaling into the Medicare program. So we are looking at guide in a very similar way, where we can see what works. And to come back to that bundled primary care code, is there something from the guide model that can help guide, no pun intended, the development of a future, of a next iteration of bundled payment. We can get more information on what aspects of the caregiver training that's in the guide model are important to incorporate, into the Medicare program overall. So I think there are many opportunities for sharing lessons learned there.
Absolutely. And I think one of the important things to recognize about both the guide model and the caregiver training services is that they both help to advance a vision outlined in our nation's first ever national strategy to support family caregivers, where CMS has an outsized role in advancing, in particular, Goal 2 around building stronger partnerships and engagement with family caregivers in care teams. Can you talk a little bit about CMS's support and vision and why you think that a national strategy and driving action on that strategy is so important?
Yeah, I mean, it has really been amazing to be able to partner with the Administration for Community Living on the National Caregiver Strategy. And I think it is so important because it comes back to where we started our conversation, that we need to highlight that we have 53 million people in this country who are the backbone of our care system. And if we want to change our healthcare system so that it's not just treating a diagnosis code, but it's actually caring for a person, you can't do that if you're not considering the caregiver that is helping to care for that person. So I think number one, being able to elevate that conversation about the importance of caregiving. Number two, to show that caregiving is part of everything that we do in Health and Human Services and part of everything that we do at CMS. So, that's another aspect that's been very important with the strategy, and that comes back to, we've talked about the caregiver training codes and we've talked about the guide model. But some of the other things that we have done, starting with the physician fee schedule, where now we're paying for community health services, we're paying for care navigation for people with serious illness. What are things that caregivers were picking up the pieces because the system did not take care of it? So now we are providing resources that can be used for food, for transportation to doctor's appointments, for a social worker to be the one who's helping someone with serious illness to be able to navigate the system to, again, provide support to that caregiver. In Medicare Advantage, the things that we have done on prior authorization is incredibly important for caregivers. Again, lived experience. I was doing a session with AARP in New York, and before my session, I had an hour break for lunch, like with the day of events. I was on the phone with a family member's insurance company trying to navigate a prior auth for them. They didn't know who they were talking to. Right? But I think that any of us, and I mean, every time I have to do this, I'm like, I'm having trouble with this. How does anybody, who doesn't have an MD and a PhD know how to do this? So where we have streamlined prior authorization in Medicare Advantage, so if there's a traditional Medicare covers this, Medicare Advantage cannot create additional hoops. That's something that supports caregivers. Marketing. So 2 years ago, my dad calls me and he says, oh, I saw this ad that if I switch to this plan, I'll get a grocery card. My mom is yelling at him in the background, don't listen to them. Talk to your daughter. She knows Medicare, right? What do caregivers have to deal with? The bombardment of misleading marketing. So we rejected more than 1,000 TV ads for being misleading. That's something that supports caregivers as caregivers are trying to navigate for their loved ones the different options. So I think it's also important to remember that caregiving, every aspect of our healthcare system, especially where it doesn't work and it's complex, the caregivers are the ones who are facing that burden. And so really, I think the caregiver strategy has been very important in emphasizing just that foundational role that caregivers play, and thus how we have to think about caregivers in every aspect of policymaking.
Absolutely. I think you underscore beautifully the reality that when we think about the work of caregiving, when you think about the instrumental activities of daily living, one of those key activities is advocacy. Advocacy on behalf of the person you're caring for, that navigation through a system, and we need to do more to recognize and value that, but also to lower the expectation on that being a necessity for developing and delivering quality care. Because we have 2 minutes left, I'm going to go rogue. This is a room full of advocates who are thinking about the care continuum across the lifespan, across an ecosystem that is going to have to continue to advance the vision that we've talked about today of better supporting family caregivers under a new Congress and under a new administration. What advice do you have to these advocates to keep up this momentum moving forward?
Well, I think a few things. Number one, personal stories have real impact. You know, it's all great for me to be up here saying, well, there's G2211 and there's, this other thing, but where it really comes to life is the impact that it has on people. And I think the telling stories to demonstrate the ideas that you are discussing is and continues to be very powerful. And I also think just remembering, Medicare, it's like 3 layers. There's the law, which is at like the 50,000 foot level, which provides us with the legal authorities to then make our regulations, which is at like the 25,000 foot level. And then you have how care actually plays out on the ground. And knowing which lever you need to pull, where you have leverage to be able to influence that, I think is very important. And so, I think all of that, and I do think that caregiving is something that everyone experiences at some point in their lives, and being able to tap into that so that this can really be a conversation about how do we enable people to be healthier and stronger living in their communities.
Wonderful. Well, thank you so much, Dr. Seshamani, for your words, for your leadership, and for your fierce public service. And now we're going to welcome to the stage Dr. Barbara Lyons, the founder of Cascada Consulting, for our next panel.
Oh, we're taking a photo.
Oh.
Do you want us here?
Thank you.
Now you know I was.
Should we do it on the way out at the step and repeat? Wow.
Can you hear me now? Okay. Thanks so much for joining us now you can hear me. For joining us this morning for this panel discussion. My name is Barbara Lyons. I am principal and founder of Cascada Consulting, which is an independent research firm that's focused on how to improve Medicare and Medicaid
It's our charge.
For individuals who, particularly those who have long-term care needs and their family caregivers. I'm really delighted
and it's on the way
to have
out.
the honor of moderating this
But
panel.
thank you so much. You did always
and to
do
follow
amazing,
the
but I
excellent
really
remarks
appreciate
offered
you,
by Dr. Seshamani
anchor it.
in her conversation with Jason. So the title of this session is Bridging the Gap, Medicare's Role in Supporting Family Caregivers. As was highlighted by Dr. Seshamani, family caregivers are integral to the health and well-being of Medicare beneficiaries, including seniors, but also individuals under 65 who have a range of disabilities that include physical, behavioral health, intellectual and developmental disabilities. Family caregivers, as was noted, provide a wide range of tasks, many of which are complex medical management duties, and also provide just a crucial link to the medical system for Medicare beneficiaries. Yet they are not routinely considered part of the team in caring for someone. Their voices go unheard. And the burden of caregiving, as was mentioned, takes a heavy toll on both their physical and especially their mental and emotional health. It's a really arduous job. So our discussion today is going to focus on how to leverage Medicare to more fully recognize and support family caregivers, building on the work that was set in motion under the Medicare program already, and complemented by the RAISE Act. So we're going to hear from a panel of 4 experts who will provide different perspectives on this issue. Amber Christ, the Managing Director of Health Advocacy, Justice and Aging, Dr. Chanee Fabius, Assistant Professor at the Johns Hopkins Bloomberg School of Public Health, Sue Peschin, President and CEO for the Alliance for Aging Research, and Dr. Madhavi Vemireddy, co-CEO of CLEO. I'm going to let each of them introduce themselves and provide a little more information about themselves as we get into this discussion this morning. Their specific bios are on the website, but they really bring an incredibly rich background and perspective to this conversation. So let me begin by just first thanking each of you for being here today. And let's start out with each of you telling us a bit about yourselves and your organization, your connection to caregiving, and why you think Medicare matters for family caregivers. And let's start at the far end. Sue, let's start with you.
Oh, sure. So hi, everyone. Again, Sue Peschin. I serve as President and CEO of the Alliance for Aging Research. And our mission is really about changing the narrative to improve healthy aging and improve equitable access to care. I am a family caregiver to my mom, who has Alzheimer's disease, moved to the Rockville area, which is where I live, 4 years ago, around the time of COVID, actually. And it's been quite a journey, interesting journey. I was struck by a couple of things that Dr. Seshamani said that I just wanted to bring up as kind of teasers as we get into our discussion here. She mentioned that the Center for Medicare and Medicaid Innovation is kind of like the laboratory for Medicare. And any of you who worked on the Affordable Care Act know that as part of the statute and the creation of CMMI, is part of its charge is to show savings. And it's to show savings to the federal programs, not to patients and families. So that's really important to think about when you think about the types of pilots that are there. For example, one of the efforts that was part of the Affordable Care Act was Independence at Home. And that is one of the ones that's languished in CMMI, and it's because it's shown to be budget neutral. In other words, you can't even be budget neutral, you can't even cost. You have to show savings. So that has languished. So GUIDE is a bit of a variation, sort of a lighter, version of some of the types of programs that have already gone through. So I think that's important for us as an advocacy community to think about, is understanding the way the system works. So she kind of made a joke, whoa, we could talk about CPT codes, all that kind of stuff. None of this is rocket science. And it's important to know how to dive into it a bit more, because part of what, I think the narrative is we need to just mobilize communities and all of that. And truthfully, we need to get more of all of you engaged in the actual process and pushing the agency to serve their people. And the last thing I'll say is, every year Medicare puts out a trustees report, which talks about the health of the program itself. And since COVID, there has been an algorithm, that has been in there around savings. What happened during COVID that Medicare identified is, as many of you may have seen in the press, they've extended the viability of Medicare for another couple years. How did that come about? A big chunk of that came about because this algorithm showed that the people that were the sickest and used Medicare the most prior to COVID were the ones most likely to die of COVID. And this algorithm will be in place until 2029. So that is the way that the program views families. And I am not in any way saying that there has not been anything good and steps being done that have been positive. But it's just important for us to understand the context of who we're dealing with. And as advocates, I think we need help from public and private payers almost more than any other issue that's going on today.
Thank you, Sue. So let's go next to Chanee.
Good morning, everyone. I'm Chanee Fabius. I'm an assistant professor, as she said, at the Johns Hopkins Bloomberg School of Public Health in the Department of Health Policy and Management. I describe my work as understanding and addressing inequities in long-term services and supports for older adults, their family caregivers, and the direct care workforce. I, too, have personal caregiving experience. At a young age, helping care for my grandfather who lived with dementia for quite a while, and also helping provide care for my mother. And that influenced me so much that I became a care manager for the Connecticut Home Care Program for Elders. And so that is what really, I lean into those experiences now as a researcher, and as was spoken earlier, what it's like to be on the ground, right, in people's homes, and what services really play out as. A lot of my work focuses on dual enrollees, so I do a lot of work with Medicaid, home and community-based services, but I think the important thing, and some of what we'll get into that I'll mention today, is around equity, right? And just understanding that any policy or recommendation that we put forth has to prioritize equity. And when I say equity, I study racial and socioeconomic disparities, but I'm, referring to rural disparities, right? I'm referring to people from sexual and gender minority populations also, and their experiences, and having the adequate data to be able to address those experiences. So I'll stop there. I'm sure we'll get into it more later, but thank you for inviting me today.
Great, thanks so much. Okay, let's turn to Amber.
Thanks, and thanks for having me here today. Amber Christ, I use she, her pronouns. I'm the Managing Director of Health Advocacy at Justice and Aging. For those of you who aren't familiar with Justice and Aging, we're a national organization, and for over 50 years now, we've been working to fight senior poverty, and we do that through increasing equitable access to health care and economic security for older adults with limited resources. And absolutely essential to that mission is giving the care and support to older adults that they need to age in their homes and be connected to their communities. And I think we've heard over and over again today that so much of that support is coming from unpaid family caregivers, and disproportionately women and women of color. And that's because, and then this has been said too, is that societally we have put that burden, or not necessarily burden, but that responsibility on families and on individuals rather than it being a societal issue, and one that should and could be supported through public support and through programs like Medicare. And the result, of course, is really huge impacts for family caregivers, from taking time off of work, leaving the workforce entirely, paying less into Social Security and retirement over time, increasing the likelihood that those individual caregivers are going to age into poverty themselves, and not to mention the very complex personal and emotional dynamics that you are working through as a caregiver, providing very personal care to a loved one. And so Medicare right now, as designed, is not providing that paid caregiving, that coverage that supports older adults and their families. And a result of not having that coverage, we're really seeing Medicare as a program kind of perpetuating poverty by relying on unpaid caregivers to provide that care. And if not just relying on perpetuating poverty that way, we're also requiring people to spend down all of their resources into poverty to access paid care through the Medicaid program, which obviously is such a bedrock program, and one that we've heard about today off and on from the speakers, that is the core program right now, providing home and community-based services, but for people with very low incomes, particularly for older adults and people with disabilities. So I think Medicare, as the universal program serving, I think it's almost 70 million people, older adults and people with disabilities now, I think there's just enormous potential to strengthen the paid caregiving through the program, and we can get into some more details on how we think that can happen.
Great, thanks, Amber. Okay, let me turn finally to Dr. Vemireddy.
Sure, thank you. My name is Madhavi Vemireddy. I'm CEO of Clio. I'm a physician by background. I've been in population health for about 20 years now, and in digital health for about the same time. But I'm also an active caregiver for my eldest son. I have 2 boys. My eldest son was born prematurely in the NICU for several weeks, diagnosed with a rare congenital heart anomaly that required open heart surgery at 9 months. He was only 9 pounds at 9 months. And then we were on the path of catching him up, and then at age 5, he was diagnosed as being on the autism spectrum. So at age 14, he is non-speaking, he has significant motor delays, and so my husband and I, we've been active caregivers for him. And given our professional experience building population health programs, we said, you know what, caregivers are the largest providers of care in this country, yet there is no population health program for family caregivers. So you don't see the risk that family caregivers bear. You don't have programs targeted at supporting family caregivers. And so we started a company called Care Tribe in 2019 that was really focused on taking a population health approach to supporting families, irrespective of what age their loved one was, whether it was a child with special health care needs, or a partner, or spouse, or a sibling, or a parent, and irrespective of the condition. And so that company was acquired by Clio in 2022, and so that's how I met Clio. So at Clio, we take this population health approach. Knowing that family caregivers majority of them are employed, we started really in the employer market, saying if you are focused on the overall health and well-being of your employee population, you have to think about not just mental health programs and condition-specific programs, you have to think about caregiving programs, because the majority of your workforce is caregiving. The problem is that it's hidden. It doesn't show up on a claim line, right? People don't want to talk about it because of that stigma. And then there's the awareness problem where, if I wasn't doing what I was doing, I would think, oh, I'm a mom, right? It's because I have that awareness that, no, I'm actually a caregiver. I'm coordinating my son's care. I am doing everything I can to help him communicate, to help him to get to independence. And so we take this population health approach by having analytics so that we can identify, are you a family caregiver that is already at the stage of burnout? Or are you on that rising path to burnout? Do you already have mental health strain? You already have early signs of depression and anxiety? And what is your specific caregiving situation? And who are you taking care of? Because we know, like, if you're in that sandwich generation, or if you're taking care of a loved one with special health care needs, your risk is going to be significantly higher for burnout, for mental health strain. And so we want to find them early on. We want to connect them to experts. We want to really provide them that very tailored support and connect them to other programs, other benefits that the employer is offering, those community resources. And so I know we'll get into it further, but we just see significant opportunity in terms of supporting the family caregiver as well as the care recipient.
Great, thank you so much. And thank you to all for your opening remarks here. And I think we can see so clearly the interaction between personal experiences in caregiving and professional experiences trying to address the issue and improve the situation for folks. So I'm going to follow up with some specific questions, starting with Sue. So Medicare is primarily focused on the needs of the individual beneficiary. That's where the entitlement is. But we know that the family caregiver plays an important role in the health of that beneficiary. What are the most impactful ways that you see that Medicare can be adapted to recognize and to support the essential role of family caregivers to achieving better health outcomes for the beneficiary?
Absolutely. Well, we are very honored to be members of the National Alliance for Caregiving, and just really appreciate all the leadership that they've shown in pushing for all the types of reforms, and probably more reforms just in the last couple of years than I've seen in the time I've been working in the space. So kudos to NAC, and thank you for the work that you're doing. I do think that there could be more that both Congress and Medicare can do. Lifespan respite has been underfunded. We advocate on that issue. I think programs like Independence at Home, like the REACH program, which is more specific to Alzheimer's disease, that has actually been adopted by the Veterans Administration and has been around for 30 years. And it has not been brought up as a consideration within the Medicare program. And as a family caregiver now who's doing, actual, hands-on caregiving and up until actually September, quite a bit of personal care too for my mom, it would have been tremendously valuable. There were so many things. I mean, I lean on the pharmacist, everybody around the doctors is who I lean on. And we need so much help in terms of training and guidance. So I just think there's a lot more that the program can do. But again, to me, it's really a transformation in the program itself that I think is going to come as we continue to age in this population to demand that our federal healthcare program start putting, health risk ahead of financial risk, and not financial risk on government, but financial risk on all of us.
Thank you so much for those comments, and I think that builds on what Dr. Seshamani said earlier about what we're starting to see in Medicare is just a greater recognition of the family caregiver, and we're starting to take steps in that direction. Turning to Amber, though, as an advocate who uses the power of the law to fight senior poverty, what are the biggest barriers within the current Medicare system that prevent adequate support for family caregivers?
Yeah, coming at this again through paid caregiving and trying to bolster paid caregiving within Medicare, I think one of the big barriers in the program today is that originally, over almost 60 years ago, we're about to celebrate Medicare's 60th birthday, it was an acute care benefit, so short term. And there's been a lot of progress made to get beyond an acute care benefit, and notably that's been the home health benefit. Yet there's real limitations with the home health benefit, the Medicare home health benefit, and a lot of misunderstanding about the Medicare home health benefit. People think it's short-term, but actually it's not. It does require someone to have a skilled need, but you can also get personal care services. Unfortunately, though, today it is not working as intended and to the full extent that it is authorized to do under the law. And our partners at the Center for Medicare Advocacy have done enormous amounts of work to illustrate those problems and highlight where we can advocate with the Centers for Medicare and Medicaid Services to actually make the home health benefit work as it's intended to do. Because if it were working as it is intended to do, it would provide significant support to family caregivers through paid caregiving. But it's not working that way today. So I think that that's a significant barrier, and there's ways we could work to address that, and directly with the Centers for Medicare and Medicaid Services. Even though if that were, we marked that off the list, that benefit still has limitations. It does require having a skilled need, and that leaves out people who do not have that skilled need, and I'm thinking in particular around Alzheimer's and dementia. So another thing we could do is expand beyond the home health benefit to provide at-home care, where we are getting personal care services long-term for things like dressing, bathing, helping with cleaning. And that would have to require some act by Congress, but that's another significant barrier. I'll also note that for people who are dually eligible for Medicare and Medicaid, almost 13 million of those individuals, navigating between Medicare and Medicaid, two programs that while are authorized together and passed into law together, were never intended to work together and have different program rules, scopes of coverage, and people are stuck trying to navigate both of those programs. Older adults are stuck navigating those programs, and their family caregivers, like Jason said that his mom used the F word for the first time that he heard with insurance companies, try navigating through two different insurance companies, and even choosing two insurance companies. So I think there's a lot we can do to better integrate and coordinate care. I failed to mention in my opening remarks my connection to caregiving, but one is through my grandmother who developed dementia but had a lot of declining healthcare needs, and we were acting as her family caregivers for 8 years of her life. And it was denials of the home health benefit from a Medicare Advantage plan that led to a lot of cascading events and ultimately a nursing facility placement. So I just think that there's a ton we can do administratively there. I would be remiss if I didn't mention Medicare Advantage. A lot of people would ask, Medicare Advantage can offer supplemental benefits and they can help support caregivers. And I think there's absolutely a role for Medicare Advantage. to test those kind of innovations out. But those supplemental benefits are just that. They are supplemental. They are not comprehensive, and they are not consistent. Different Medicare Advantage plans offer different supplemental benefits, and even within plans, those differ from year to year. And we have very little data right now to the extent that they are being utilized and the actual access to those benefits. So I think Medicare Advantage has a role, but I think when it comes to actual comprehensive paid caregiving, we have to look at traditional Medicare and making investments in the paid caregiving benefits through traditional Medicare.
Great, thank you so much. And touching on Medicare Advantage, it brings to mind the issues that Dr. Seshamani raised around marketing.
Yes.
Because people do value those supplemental benefits so much, but when you've got disabilities, you still need access to your providers. So it raises some issues there. Let me turn to Dr. Fabius. So what do you think are the most critical disparities facing family caregivers that you think Medicare can be a partner in helping to address?
Thank you. And Amber took a lot of what I was going to say. No, it's okay. That's good. That's good. Yeah, the paid caregiving really is my jam. So she did say a lot of things that I agree with, but I want to put into context, when we talk about disparities, and we think about sort of the landscape of family caregivers that are providing care, we know that Black caregivers, for example, are providing more hours of care per week, right? So more likely to be providing full-time care, like 40 or more hours of care per week compared to their white counterparts, more likely to be caring for people with dementia, more likely to be caring for people with a greater level of limitations or disability, more likely to be caring for people who are enrolled in Medicaid. And so that is, and that sort of follows in many Black and brown communities. I think the other thing to think about is that I mentioned rural communities also have similar challenges. I think one thing that stands out that I do want to note is that, in some of our work that we've seen these disparities, we do see that Black caregivers are less likely to report things like emotional burden related to caregiving, despite those challenges. And so while that may speak to a level of resilience, for lack of better words, there's still much that needs to be done to support these caregivers. I think to the earlier panel, the financial burden that caregivers face, right? So 40 hours a week on top of a full-time job is what, right? So that takes a serious toll on top of caring for children, right? That takes a serious toll. And so I do want to acknowledge that Medicare does have a health equity plan, right? So they have a framework, and I believe it's, a 10-year sort of framework that calls to the table, data collection, expanding access to services. One thing that the Medicare program has done and should continue to do is make telehealth, right, a priority, especially for people in rural areas that just have a lack of access because there are limited providers. I think another thing that has been talked about a few times is GUIDE, right? And one thing that I think is important about GUIDE and its care coordination prioritization is the assessment of health-related social needs, right? Because so much of this is beyond what the original intent of Medicare was for. But to Amber's point, there's the Medicaid program and there's the Medicare program and there's everything in between. And a lot of people are in between, right? Because you have to have a severe deficit in income and be disabled to receive Medicaid benefits, and then you still have a wait list issue, right, depending where you live. I think a couple years ago, it was like 707,000 people nationally on Medicaid waiver wait lists. And then on the Medicare side, there is a lack of understanding, I find, in many of our communities of what Medicare can actually do, right? So it's like, oh, Medicare will take care of it. No, it won't. It won't. And so I think that, as I said, I think that, addressing issues related to telehealth, prioritizing those social related needs that, lap over into social determinants of health, right? Beyond the Medicare program, thinking about paid family leave. We talked about employers earlier, but just having a real effort to understand the context in which people are receiving services. And then the other thing I'll say is that Amber raised the point about Medicare home health. We see disparities in Medicare home health, right? Access, Black folks are less likely to receive the same number of services as people, as their white counterparts. And so what is that, so I think that there has to be a lot more information that we gather about that. We also see, we talked about training a few times, racial and ethnic minoritized groups are less likely to receive training, right? Post-hospitalization. And so when we talk about Medicare prioritizing training, if you address the needs of the older adult, many times you do, in fact, address needs that family caregivers had, because we see those inequities so clearly in all of the things I just mentioned. So I think that, I do, kudos to Medicare for saying, we have this health equity plan. Kudos to them for having health equity at the center of GUIDE as well. I think that that's just really important. I think that there will have to be follow-up accountability to ensure that the things that we lay out in those plans continue to be met. And of course, there are plenty of researchers, I'm sure, that are interested in seeing the progress of those things.
Great, thank you so much. And I think the point also that you raised about the paid workforce being an important complement for family caregivers, having folks to support the family caregiver to provide respite and take some of the burden off is hugely important. Dr. Vemireddy, so how can technology and innovative care models such as telehealth, which we've just been talking about, be leveraged further within the Medicare system to better support family caregivers and improve care coordination?
Yes, we see significant potential to leverage technology, telehealth, especially as you think about understanding, how do we best understand the needs of that care recipient? What health conditions do they have? Do they have a caregiver or not? Just again, helping them understand that there's this program that is not only supporting you with your health condition, but helping you to navigate and bring in the right resources. But oh, by the way, there's also, the extension of this program to support your family caregivers. One of the surveys we did, about 64% of Medicare eligible individuals basically said, I would not ask a family member, or I would wait till the very last minute to ask a family member for help because I do not want to be a burden. So that is essentially setting them up for negative health outcomes because they don't want to be a burden. So just knowing that, oh, my Medicare plan not only cares about me, but they care about my family, and they're going to be providing them the emotional well-being support, or training them, providing them the education, helping them navigate and bring in the right resources. And we see working with family caregivers, they are so overwhelmed. They're working that full-time job. They've got children at home. They're in the sandwich generation. They're obviously doing their best to take care of their parents or other relatives or friends. And where do you even start, right? Everyone's Googling, content. What am I supposed to do? Or if you're saying, hey, you need to go find a home care provider, where do you even start, right? And so this is where it's really important to be connecting families with a dedicated guide, which is what we do at Clio. This is your quarterback. This is your person that can bring in specialists that have expertise, whether it's in dementia or in cancer care, and help you, educate you on what to expect with this health condition, help identify early risk factors. Is your loved one at risk for a fall? How many times are Medicare eligible individuals actually going through a fall risk assessment with their PCP? It's not happening, right? But these are 3 simple questions that your family caregiver can ask you and determine, yes, I think actually, mom or dad is at risk for a fall. What do I do next? Help you coordinate. Maybe you need to get a home safety assessment done. Or here are the questions you need to go talk to your doctor about so that you can ensure that they get a full fall risk evaluation. And it's that constant monitoring, because we know that we have to really proactively screen the family caregiver as well as the Medicare eligible individual, because things are changing, right? Your care can progress. So maybe today you got a good handle on the situation, but tomorrow mom falls and has a hip fracture, and now you've got to navigate the hospital stay. You got to be ready to get them home and back to the hospital. So there are these transitions of care. There's just constant support throughout sort of that care journey, but really having this almost family-centered care model that allows you to understand what is the MA member's needs, but also, what is the needs of those caregivers. And, as we talked about earlier, many Medicare eligible individuals are caregivers themselves.
Exactly.
While they're also receiving care, right? And so that's obviously going to put have a significant impact on their mental health strain, on their isolation, and their health.
Great. Thank you. I think navigation is an issue that comes up repeatedly, almost the first thing from caregivers, that the system is so complex and difficult to navigate. And as you said, you don't have time. We've heard from caregivers who say, I Google at midnight to try to figure stuff out, but it's very, very challenging. So as we come to the end of our time here, we've had a rich discussion, but I want to ask each of you, looking ahead to the next 5 to 10 years, what single word best captures your vision for the future of Medicare support for family caregivers? And this time I'll start here with you.
So I would say it's a phrase. I would say family-centered care.
Family-centered care. Great. Thank you. Amber?
Just checking. I was going to say equity.
Equity.
Yeah, I think.
I see why you're turning to.
Yeah, I was going to say the same thing.
Yeah.
So we say equity.
That's right.
You can pick the same word. That's okay.
Yeah, we
Equity.
say
It's
equity.
important.
All
Okay.
right, I would say dignity.
Dignity, yes. All right, great. Well, that was very great. I really appreciate all of your comments today. I think we touched on a number of issues that are really important for family caregivers, and just really glad to see the attention focused on the family caregiver as being really essential to the health of the Medicare beneficiary, and that there are ways within Medicare that we can actually improve the way things work for people and support that care going forward, because looking out at the demographics, we're going to need it. So thank you very much. Let's have a round of applause for our panel.
Thank you so much, Barbara, for that discussion, and for the panelists. I've heard so many ideas, opportunities for advocacy, for innovation, for storytelling, to help us strengthen and transform the Medicare program. Lots of food for thought going into lunch, and that was a dad joke, and I have to get them all out before my toddler learns how to roll his eyes, so get him, bear with me. But before we go into lunch, I want to ask you to turn your attention to the video screen for a message from our visionary care sponsor, EMD Serrano. EMD has been a cornerstone partner of NAC for more than a decade, and they are a true believer in the power of family caregivers and carers to transform our healthcare system.
My name is Heather Connor, and I lead communications for the global healthcare business of Merck KGaA, Darmstadt, Germany, known as EMD Serrano in the US and Canada. I joined the company about 21 years ago and have stayed and built my career here because I truly believe in our purpose to help create, improve, and prolong lives as one for patients. And this includes supporting caregivers, who are such an important part of making that purpose a reality. This is a commitment that is deeply personal to me. I'm a mom. I have 2 kids. My son Jake is 15 and my daughter Reagan is 14. About a year and a half ago, Reagan started losing weight. She was really thirsty. She was tired all the time. And then one day she just hit a wall. She couldn't get out of bed. Long story short, she ended up in the emergency room and was diagnosed with type 1 diabetes. Type 1 diabetes comes with a tremendous disease burden. It's a disease that needs to be managed day and night, sometimes every hour, sometimes every minute. With her diagnosis, I essentially took on a second job. It's one done with love, but it's the most critical work that I do because it's for the health and well-being of my daughter. I am incredibly grateful that at EMD Serrano, we offer tangible solutions for our caregivers through our Embracing Carers program. Across our global parent companies, 3 businesses, more than 41,000 employees have taken a training to learn how to better support a colleague who is a caregiver. We have a newly invigorated employee resource group to support our caregiving community. And perhaps most importantly, flexibility and understanding are inherent in our culture. About a year and a half after her diagnosis, I can proudly say Reagan is a rock star. She is an incredible student, she is an incredible athlete, and unless you notice the monitor on her arm, you would never know she has type 1 diabetes. It hasn't always been easy, but we've come a long way in the last year and a half. I'm very grateful that she is happy, that she is healthy, and thanks to our industry, she has everything that she needs to thrive. I'd like to share my sincere thanks with EMD Serono for always taking care of your caregivers and creating and sustaining a culture in which colleagues can balance their career and their critical role as a caregiver. Thank you.
Great. And now we invite you to join us for lunch in the tent across from the hallway. Please use this time to connect, to movement build, and to replenish ahead of a full afternoon of amazing conversations, including closing remarks from Governor of New Mexico, Michelle Lujan Grisham. Thank you.